I'm Fred Schreuder. I'm a consultant plastic surgeon with a specialist interest in hand surgery, and I practice here at Hatfield Hospital doing the entire gamut of plastic surgery, including hand surgery. Carpal tunnel syndrome is a very, very common condition that affects the hand, and it is due to pressure on the nerve in the wrist in an area called the carpal tunnel, and this nerve is the most important nerve for sensation in the hand, and that's why patients with carpal tunnel syndrome start getting symptoms related to pressure on the nerve. Carpal tunnel syndrome can affect everybody. It typically affects women more commonly than men, but I see patients of all ages and both sexes. It's a very, very common condition, and I'm sure once you mention the diagnosis of carpal tunnel syndrome, you'll be surprised at how many other people have been treated for it. In general, the signs are due to signs of pressure on the nerve. So patients get pins and needles, they get numbness, sometimes burning sensations, sometimes a feeling of stiffness in the hand. The typical signs and symptoms are nighttime symptoms. So patients wake up with a tingly dead hand that they have to shake out or drop over the end of the bed. Some patients get symptoms when they're using the phone, cycling, or driving the car. Some patients will notice that actually their hands are less dexterous because their fingers have got numb. The treatments of carpal tunnel syndrome depend on the severity of the carpal tunnel syndrome. For very mild carpal tunnel syndrome that's only causing minor symptoms at night, a splint which keeps the wrist out straight may be the most appropriate treatment. Thereafter, things like steroid injections can be tried, and most patients will benefit from a steroid injection. The benefit may be short-lived or it may be quite long-term. I think most patients can have 2 steroid injections before they need to think about the surgical option. Surgery is very effective